Hello to all of you, my lovely students. This is our first part of blood sugar. Blood sugar is one of the branches of clinical biochemistry, and clinical biochemistry is one of the branches and majors of biology. Uh, the first thing that we're going to talk about is what is carbohydrate, because blood sugar is relates to carbohydrates. So, what is carbohydrate? Carbohydrates are one of the main macromolecules in the biology system. They consist of many monomers called monosaccharides, like glucose, fructose, galactose, and etc. In our lesson, our main focus is on glucose, which is the main source of energy in our body, especially for brain and muscle. So, let's go to the main parts. We're gonna talk about them later in the future video. So, carbohydrates. Carbohydrates. Carbohydrates are one of the main components of food. The most well-known role of carbohydrates in the body is to participate in energy metabolism, which takes place with the cooperation of different hormones such as insulin, glucagon, epinephrine, and cortisol. So, in the normal state, before reading these parts, I have to say we can divide sugar existence in bloodstream to three different categories. The first one is when the situation is normal. So we call it normoglycemic condition. In the normal state or normoglycemic condition, the plasma glucose level is maintained in the 70 to 99 milligram per deciliter. It means in one drop of 1 deciliter of blood, there are 70 to 99 milligram glucose in it. Okay, so the first one is normoglycemic. Normoglycemic means the range of normoglycemic is 70 to 99 milligram per deciliter. The second condition, the second situation is hyperglycemia, or abnormal increase in plasma glucose. Is the most common metabolic disorder that can lead to serious complications such as ketoacidosis, electrolyte disorders, neuropathy, nephropathy, retinopathy, and atherosclerosis. They are very difficult, and we're going to talk about in the future videos. The third condition is hypoglycemia, or lowering of blood glucose below the normal level. What is the normal level? What was the normal level? The normal level between 70 to 99 milligram per deciliter. So hypoglycemia means lowering of blood glucose below the normal level. It means under the 70 milligram per deciliter. It means for example 65, 60, even 50 milligram per deciliter. Okay, often occurs as a complication of improper diabetes treatment, which can be very dangerous and fatal in severe cases. Okay, hypoglycemia can also be the result of disturbances in the metabolism of other carbohydrates, namely glycogen, galactose, and fructose, which is especially important. It is clear. Okay. So far, okay. No. Liver. Okay. Yeah. Hypoglycemia. I have to say. I have to add some notes. Hypoglycemia is an extremely dangerous condition because, as we talked previously, the most important source of energy for brain is glucose, and according to it, if glucose decreases lower than normal range, it could be very dangerous and fatal. Okay, the next topic is liver. Liver is the main organ that removes excess glucose as well as fructose. Its function and its responsibility in our body. Actually, it's one of its responsibility in our body. Liver has lots of responsibility in us. Okay, and galactose from the blood circulation after eating high carbohydrate food. Although muscles and fat tissue also help the liver to remove excess glucose from the blood. On the other hand, in fasting and starving situations, the liver produces glucose, which is important for maintaining blood glucose and meeting the needs of nerve tissue and RBCs. Actually, liver is one of the most important organ in our body because many metabolism, like carbohydrate metabolism, actually, they are very complex, like Krebs cycle, glycolysis, or Embden-Meyerhof pathway. They are very complex, and we're going to discuss about them in later and future videos. Okay, carbohydrates, like carbohydrate metabolism, protein metabolism, and fatty acid metabolism, and nucleic acid metabolism. Actually, in medical terminology, we call liver hepato. Every time, everywhere you see hepato, it relates to liver. Okay, so the hormones. The hormones. Actually, we discussed 3 topics. Okay, and this is one, I think, in fourth group, the 4th category. The hormones that control the metabolism of fuels fall into 2 groups. Okay, the first group includes insulin, which is naturally secreted in the blood circulation I forgotten to add it, but take a note, please, that insulin is secreted by beta cells in pancreas. Okay, by beta cells in pancreas with the consumption of food and the increase of metabolic fuels, especially glucose. And purpose of it is the decrease in the amounts of these fuels through the activation of the pathway of glycogenesis, lipogenesis, and protein synthesis. It means if you eat high carbohydrate foods like lollipops, or like fast foods, they contain high amount of carbohydrates. Insulin is secreted from the beta cells into your bloodstream. Okay, so insulin consumes. Insulin consumes glucose in different pathways to reduce the blood sugar in your body, to reduce the glucose amount of glucose in your blood stream. Okay, so there are some pathways like glycogenesis, lipogenesis, and protein synthesis. Okay. Insulin, actually, I have to add a note because it is very important. Insulin is secreted from the beta cells in pancreas, and if they will be damaged, a disorder will happen that will call diabetes type 1. Because we have 2 types of diabetes type 1 and diabetes type 2. The hormones of the second group under the title of counter-regulatory hormones. Actually, I have this misunderstand. Actually, I have to replace it to counter-regulatory hormones, not anti. You have to if you are taking note, please write counter-regulatory hormones, not anti. Counter-regulatory hormones, what exactly are they? Counter-regulatory hormones including glucagon, catecholamines like norepinephrine and epinephrine, or adrenaline or noradrenaline, cortisol, and growth hormone, which is secreted from the pituitary gland. In fasting and starvation situations where the concentration of fuels metabolic bonds in the blood circulation are low, they are secreted and they act in the direction of increasing the amounts of metabolic fuels in the blood, including glycogenolysis, gluconeogenesis, proteolysis, and lipolysis. Okay, so these are pathways to produce glucose. Okay, despite the pathways like gluconeogenesis, lipogenesis, and protein synthesis, they consume glucose. These pathways, glycogenolysis, gluconeogenesis, proteolysis, and lipolysis, they produce glucose. Okay, so they are different to each other. When the plasma glucose level decreases to about 65 to 70 milligram per deciliter, the release of glucagon, epinephrine from the adrenal medulla, norepinephrine from the sympathetic nerve endings, and growth hormone and acetylcholine from the parasympathetic nerve endings occurs. Stimulation of the sympathetic nervous system leads to the stimulation of ACTH, adrenocorticotropic hormone, which is secreted from the pituitary gland. Okay. So, released followed by cortisol. Let's go to the next slide. It seems that the initial symptoms are hypoglycemia. Hypoglycemia. We've talked about, I have to say a thing to you. We've talked about different conditions of blood sugar, like hypoglycemia, normoglycemia, and hyperglycemia. Now we want to talk about the symptoms of hypoglycemia and hyperglycemia. Okay? We want to talk about the symptoms. It seems that the initial symptoms of hypoglycemia in normal people are caused by the release of autonomic neurotransmitters and in glucose plasma below 60 milligram per deciliter. These autonomic symptoms, what are the autonomic systems? Include tremor, anxiety, palpitation, increased pulse rate, and sweating due to sympathetic secretions, and hunger due to the parasympathetic vagal response. These symptoms are the symptoms of hypoglycemia, not hypoglycemia. Pay attention to the words, to the pronouncing. The normal lower limit of fasting plasma glucose is usually considered to be 70 milligram per deciliter. Values lower than this amount may be observed during long fasting, intense activity, or pregnancy. So, these are the symptoms of hypoglycemia. Let's go to the next slide. Drugs. Okay, drugs. Drugs, especially insulin. And drugs that are stimulating insulin secretion, such as sulfonylurea, are the most common causes of hypoglycemia. Pentamidine is a drug. Pentamidine is a drug that is used to treat pneumonia caused by pneumocystis carinii, and it leads to hypoglycemia through the damage of pancreatic beta cells. Okay, so some drugs can damage beta cells in pancreas, like pentamidine. The second group of drugs is beta blocker drugs, such as propranolol. Propranolol is a drug which reduces the heartbeat, cause hypoglycemia by opposing the effect of amines in stimulating glycogenolysis. Hypoglycemia caused by the use of salicylates. It is familiar to us because one of the most common group of salicylates is aspirin. Okay, so salicylates due to increased use peripheral glucose due to uncoupling of oxidative phosphorylation, and also due to decreased hepatic gluconeogenesis and increased release insulin. Okay, and the last one and the last reason to cause hypoglycemia is alcohol. Alcohol can I hate it. I hate it because alcohol can damage your body, can damage all of your organs like kidneys, like heart, brain, liver, and stomach, and etc. Following consumption of 50 to 300 gram alcohol and not eating food after it, hypoglycemia usually results due to inhibition of gluconeogenesis. Gluconeogenesis is a pathway which produces glucose for us, and alcohol prevents it. Okay, alcohol prevents and inhibits it. And depletion of liver glycogen. So, next slide. Hyperglycemia. We've talked about normoglycemia, hypoglycemia, and the third situation is hyperglycemia. Hyperglycemia is a condition characterized by a plasma glucose level equal to or greater than 126 milligram per deciliter. Okay, so hyperglycemia means a range equal to or above or greater than 126 milligram per deciliter in 126 milligram in 1 deciliter of blood. Type 1 diabetes includes about 5% to 10% cases of diabetes that can occur at any age, but it is more common in children or young adults. Previously, this type of diabetes was called juvenile onset diabetes and insulin-dependent diabetes. And these are older and previous names of diabetes type 1, but nowadays we call it type 1 diabetes. In type 1 diabetes, there is an autoimmune destruction of pancreatic beta cells, and as a result, there is a decrease in insulin production. Characteristics of type 1 diabetes include sudden onset, dependence on insulin, and tendency to cause ketoacidosis. These are the characteristics and symptoms of diabetes type 1. Okay, so diabetes type 1 is a disorder, it's a disorder that's is an autoimmune destruction which immune system find out beta cells and foreign cells, okay, not familiar cells to body. Immune system finds out beta cells, foreign cells, okay, so beta cells actually. So at the time of diagnosis, these patients have antibodies, okay, antibodies against beta cells protein in their blood circulation, which increases. So look, in patients with diabetes type 1, we have some antibodies in their plasma. If it means that if we search these antibodies, we can find out to that person, that patient has diabetes type 1 or doesn't have. Okay, so one of the which we have 5 groups antibodies. The first group is islet cell antibodies or ICA. Please memorize their abbreviations. For example, islet cell antibodies, its abbreviation is ICA, islet cell antibodies. The second one is insulin autoantibodies, IAA. The third group is glutamic acid decarboxylase, GAD. The fourth group is IA2, and the last group or the fifth group is ZNT8. Okay, so these are the antibodies. We can looking for them and to find out if patients has a diabetes type 1 or doesn't have. These antibodies are not directly involved in the destruction of beta cells. In fact, this instruction is done by T cells. is done by T cells, lymphocyte T cells. This disease in adults often has a slow onset and sometimes leads to wrong diagnosis. So it is called latent autoimmune diabetes of adulthood, or LADA. Okay? These patients may maintain a sufficient number of beta cells and have no ketosis at the time of diagnosis, but in a progressive manner with a decrease in the mass of beta cells to become insulin dependent. Okay, so we've discussed about type 1 diabetes. So let's go to the type 2 diabetes. Type 1 diabetes is an autoimmune disorder. Okay, let's go to type 2 diabetes and discuss about it. Type 2 diabetes includes about 90 to 91% cases. Type 1 diabetes includes only 5% to 10% cases, but type 2 diabetes includes about 90 or 9 to 95%. It means that type 2 diabetes, it is very more common than type 1 diabetes. Cases of diagnosed diabetes, which is usually seen in middle-aged or older, but there is a possibility of seeing it in children and teenagers. In these two groups, they are more common than the other groups. Previously, this type of diabetes was called diabetes with the onset or non-insulin dependent diabetes, like diabetes type 1. Diabetes type 1 has multiple names, multiple old names, and type 2 diabetes also has multiple old names. So, glucosuria. What is glucosuria? Glucosuria occurs when the glucose level exceeds the renal glucose reabsorption limit, approximately 180 milligram per deciliter. So, I have to say, and I have to add a note that if the urea suffix anywhere, anytime, okay, if you hear or if you see any urea suffix which connects to a word like glucose, glucosuria, galactosuria, okay, ketonuria, okay, something like these words, something like these conditions, and make glucosuria, it relates to urine, okay? So you have to memorize that urea relates to urine, okay? And on the other hand, Mia suffix, M-I-A, Mia suffix, if this Mia suffix connects to a word, they make some words like ketonemia, okay? And this suffix relates to blood, okay? It is very easy as a piece of cake. Urea relates to urine, Mia relates to blood. Easy as a piece of cake, okay? So, this condition leads to osmotic diuresis, which is clinically characterized by polyuria. Polyuria means many times going to WC to excretion, to urine excretion, okay? Including nocturia. Nocturia means urine excretion at night, okay? Urine excretion at night. The resulting dehydration leads to thirst stimulation, and as a result, polydipsia. Polydipsia means feeling thirsty a lot. Following uncontrolled hyperglycemia, polyphagia also occurs. Polyphagia means you wanna eat food, okay? You wanna eat food for very much, okay? So, for example, 2 portions of kebab with rice. Okay. 3 poly include polyuria, polydipsia, and polyphagia are the most common symptoms in symptomatic patients of both type 1 and 2 diabetes. In the absence of insulin activity, lipolysis. Okay, before this, I have to ask a question of you. So there's a question I want to ask you, that if glucose isn't present in the blood, what's the energy source for brain? It's a good question. Please answer in the comments. Okay? Schreib in die Kommentare in German. Lipolysis is stimulated and fatty acids. Okay, in the absence of insulin activity, lipolysis is stimulated and fatty acids are provided to the liver to convert them into ketone bodies. So our answer is ketone bodies. If the glucose absent in the bloodstream, ketone bodies replace it and takes its responsibility, like meet the needs of nerve endings and RBCs. Okay, so the result is an increase in the amount of ketone bodies in the blood. Increase of ketone bodies in the blood means ketonemia. Okay, got it. Followed by an increase in their urinary excretion. It is called ketonuria, ketonemia, and ketonuria, respectively. Okay, so our lesson part 1 has finished, and I hope you've learned something useful, and if you learned anything, please comment for me below and give energy to me to keep pushing and keep teaching. Okay, keep teaching for you guys. Thank you very much to listen to the class, and I hope that you learned about blood sugar, although this is part 1. And in the next video, we're going to discuss about blood sugar medical tests, like as you are seeing, blood sugar, serum glucose, and other tests, which can gather info about the glucose situation in our body. Okay. And I want to say something into my native language, Persian. ممنونم از اینکه گوش دادید و امیدوارم که چیز خوبی یاد گرفته باشید و همین دیگه. در پناه حق. خدا نگهدار.